Welcome to the Gold Standard Radio Show. I'm Craig Goldenfarb, your host and the founder of Goldlaw. We've been a personal injury law firm in West Palm Beach for 25 years. This is the show where we spotlight the individuals and organizations making a real impact in our communities. Those who embody excellence, integrity, compassion, and the gold standard in everything they do. Every week we'll sit down with game changers, difference makers, and unsung heroes who are shaping the future of Palm Beach County and beyond. Whether it's through advocacy, innovation, or service, these are the people setting the bar high and showing us what it truly means to lead with purpose. So sit back, get inspired, and let's dive into the stories that define the gold standard. Good morning and welcome to the Gold Standard Radio Show. Craig Goldenfarb here of Goldlaw Personal Injury Attorneys. I have a wonderful guest with me today. His name is Chris Irizarry, and he's CEO of an organization called FoundCare in Palm Beach County here. So good morning, Chris.
Good morning, Craig. Thanks for having me.
Sure. Let's get right into it. So tell us about yourself.
So my name's Chris Irizarry. I was born in New York City and lived my entire life in New Jersey. And I started in healthcare in 2006. Started as the CEO of a federally qualified health center in New Jersey called the North Hudson Community Action Corporation. I started working there in 2006 and really fell in love with healthcare and primary care, but most importantly with federally qualified health centers. So that's a little bit about me.
And when did you move to Florida?
I moved to Florida in 2013.
Being from New Jersey, I can guess part of it was probably the weather, but why else did you move down here?
A large part was the weather, but I also had most of my family here in Florida. And so I just made a change, and I wanted a great quality of life for my wife and children, so that's why we moved down.
In New Jersey, you were part of the FQHC world. So why don't you tell the listeners and tell me what is an FQHC?
Sure. So FQHC stands for Federally Qualified Health Center. This is basically a healthcare system that was created in the mid-'60s by the United States government, really to give people with Medicaid or people who are uninsured or underinsured access to quality healthcare. So back then, folks didn't take Medicaid or they wouldn't see uninsured patients. So the FQHC movement started in the mid-'60s by designating nonprofit organizations that were doing healthcare or providing healthcare access, primary healthcare access, just regular, go to the doctor once a year service, to folks who were insured and who were not insured at all. And so that what they did is they created a system by which a person who would receive a Medicaid patient, if you had an FQHC, you receive a Medicaid patient, you receive an enhanced reimbursement. So you're paid a little bit more money than a regular private provider is paid. But with the idea and concept that you also will accept people that have no insurance at all. Place those folks on what's called a sliding fee scale. So those folks still pay, but based on family size and income. So a nominal fee, for instance, in our case, if they come to see a regular doctor for a visit and they have no insurance, they have a large family, low income, we'll pay $25 for that visit. Really what the federal government was trying to do is ensure that everyone has access to healthcare. So there's 1,400 FQHCs throughout the United States that manage multiple sites. In FoundCare's case, we manage 9 sites throughout Palm Beach County, and we count for one of those 1,400 in the United States.
So there are 9 in Palm Beach County managed just by your organization, which is FoundCare.
That's correct.
Are there other organizations in Palm Beach County that also have FQHCs?
Absolutely. So in Palm Beach County, we have a few. We have the Healthcare District of Palm Beach County, which manages a few FQHC health centers, and they're the largest. We also have Genesis, which is in Boynton Beach. They're much smaller, and they have 4 centers, I believe, that they manage. And so those are the other folks that manage FQHCs in the county.
So it sounds like FoundCare is the largest FQHC administrator in Palm Beach County.
The largest non-governmental. The healthcare district's a little larger, but they're quasi-governmental.
And what is your position with FoundCare?
So my position, I'm the Chief Executive Officer with FoundCare.
How long have you been doing that wonderful work?
Well, I've been the CEO at FoundCare since February 5th of 2022.
And what is it about your job that you love? I know you did this in New Jersey. You've done it here. It's most of your professional career. Tell us what's your passion in working with FQHCs?
My passion is to really bring healthcare to people that otherwise would not have access to healthcare. I think it's extraordinarily important in different communities, particularly those that are underprivileged communities, to offer a chance at a healthy life.
Now, it sounds like before they started this in the 1960s, doctors would not want to treat Medicaid patients because the reimbursements were so low. Is that kind of fair to say?
That's fair to say.
And so the government decided to set up an organization across the United States, I think you said 1,400 of them, that would actually bring on providers that would get a little more money to be able to treat Medicaid patients, therefore providing for more care.
That's correct.
Wow, that's great. So I have to, without trying to get into politics too much, but I know there's been a lot of talks about cuts in Medicaid. Tell me about those. Have they passed, and have they affected your career?
We are still in a sort of wait and see mode. We anticipate there'll be some cuts in 2026. Not sure exactly how deep those cuts will be. A lot depends on the state as well, and to see what types of shifts there'll be there. But there's a lot being said. Very little is known, to be honest. I think, we're all taking a wait and see approach. We're obviously being very cautious, and we know that things come in ebbs and flows, right? So we know that right now the administration is currently looking to save dollars and cut costs, and we're waiting to see how that impacts us as an organization.
I actually like government, believe it or not, or like the concepts of government. So I've got to geek out a little bit and ask you about the interplay between federally funded Medicaid and then how it's administered through the state.
So the way that it works is that the state gets funding from the federal government, and then they disperse those dollars to us. Like for instance, in the state of Florida, there was no Medicaid expansion. So a lot is being said that, well, because we didn't expand Medicaid, the state of Florida may not feel the impact of the cuts as much as maybe other states would, right? But typically, and you also have block grants, there's different ways of funding the state or organizations like ours. In our case, for instance, there's a low income pool program that we also apply for. So depending on how many uninsured patients you see, you can draw down some of the federal dollars from the state of Florida based on how many people you see that have no insurance at all. So that low income pool is dispersed from the federal government to the state, and then we are reimbursed based on how many folks we see that have no insurance.
Great. Now I understand. Hope that wasn't too deep, but I always got to know the interrelationship on Medicaid between the federal and state government, just because I'm kind of into politics. So with the number of centers you have, I'd like to talk about some numbers. You're a CEO like I am. You probably know the numbers. So you have 9 clinics. How many people do your 9 clinics see in a typical year?
So last year we managed 29,500 unique patients throughout Palm Beach County. Of those 29,500 unique patients, we managed 151,000 different services. So we are the #1 Ryan White recipient in the county. So we still see a lot of folks in HIV because that's the origins of FoundCare. We started in the HIV space. So we still manage a lot of that. And so we're extraordinarily busy as an organization and have grown quite a bit in the last several years.
That is fantastic. So I know obviously any organization, whether it's, well, first of all, are you for-profit or non?
We're not for profit.
So you are a 501c3.
That's correct.
So I'm probably going to be making a pitch at the end of this presentation to those listeners to see if you can help FoundCare, which I will be doing myself after today. So they are a 501c3 charity, so any contribution you make is tax deductible. So your mission is providing quality health care to everyone, regardless of the ability to pay. So as a CEO, like I am, I know that any organization has to be self-sustainable. So how do you guys make it so that you're self-sustainable?
So several reasons and several ways, really. There's first of all, we do operate as a business. So the way it works is we bill folks for the visits when they come in. So if a person has private insurance, we bill that insurance. So we take everyone. So we're not limited to just taking folks that have Medicaid. We're not limited to taking folks that are uninsured. We also see insured patients. So we bill for those services. Of course, there's the enhanced reimbursement from Medicaid. There are grants that we apply for that we're eligible for as an FQHC to pursue. So managing all that across the board and is what we do in order to sustain the services that we render and provide the community.
What pops in my head now that I hear that you take private insurance is a typical doctor's group will want to locate itself in perhaps a wealthy area because you're going to be around people that are insured. What strikes me as wonderful about your business model is that you can select a non-wealthy area because you know you can take private health insurance, but you also can take Medicaid. So do you select your areas to fill those gaps in the community where there might be
not be medical centers?
Yeah, Craig, that's a great question. We pride ourselves, and actually that's the purpose of FQHCs, is to find areas that are underserved. So we'll do what's called a needs assessment, and we'll try to figure out the zip codes or areas that are least served, and we'll open in those types of areas. We find those areas because we want to make sure that we're meeting the gaps in care.
And I think that leads to the word accessible, which is kind of a key part of your mission, is to make it accessible to all. Which leads me to, I think I've heard that you opened a center in Riviera Beach.
Mm-hmm.
Why don't you tell us about that?
Oh, well, that's when we opened our center in Riviera Beach, we found that area, the zip codes in that area, when you pull the zip codes from Riviera Beach out of the census tract, you realize that there was a huge health disparity in that community. So you look at areas like 33404, 33403, which are Riviera Beach zip codes, the life expectancy there is 69 versus 82 in the rest of the county.
69%. So in
69 years of age versus 82 in the rest of the county.
Wow.
Yeah.
So it's 13 years difference.
Absolutely.
And you'd attribute that, I would assume, to a lack of healthcare, a lack of available healthcare.
Absolutely. So we went to the city and we spoke to the council individually and asked them for support. And they found a lot of land that they leased to us for 99 years at $1 a year, understanding that they needed access to for their community and their residents to stay healthier and live longer. And then we also were approached by a foundation that helped us with the majority of the funding for the building. So we've put up the building. It's 20,000 square feet, right on Broadway, 3501 Broadway, and we're extraordinarily proud of this center. We opened it mid to latter part of June of 2025 and have already exceeded 2,000 patient visits at that site. And we have multiple services that we provide there: adult medicine, pediatrics, women's health, dentistry, and our pharmacy is opening there October 3rd as well.
Are there opportunities for public-private sponsorships, cooperations with FoundCare? I know you're a 501c3 foundation, but do you take money from corporations or from other sponsors? Yeah,
we'll take money from anyone that can help support our mission. As you know, Craig, we're in the business of serving others and helping folks and keeping people healthy. So many people need access to care to stay alive. And when you look at the cost of someone hitting the emergency room, is about anywhere from $5,000 to even more. If they go and get their primary health care in the emergency room, it's extraordinarily cost prohibitive for not just the hospital, but everyone else that pays in taxes and things of that nature. So we try to get people to come to community health centers to remain healthy, to manage their health care, so that there's not such a tax or a burden on the entire system.
It sounds like part of the FQHC model is preventative care instead of just treating a symptom or something awful that comes up.
Absolutely. It is driven by preventative care.
That's just a wonderful, wonderful mission. I've read that one of your missions is to have patients and the community feel that your center is their medical home. So what does that phrase mean?
So medical home means that you can go there and really have an array of services provided to you without having to go to a million other places. So as one example, one of the things that was really, really pivotal is when we started mammography, right? So 2 years before we started our mammography program, we noticed that out of 500 women we had referred out to get a mammogram, only 100 women had the mammogram done. By partnering with another nonprofit, the Promise Fund of Florida, we were able to get a mammography machine donated and placed at one of our sites in FoundCare. Since then, we've screened over 7,000 women within 3 years. So it's made a world of difference. Where the woman used to come in before and for her well visit, receive a prescription and be told, oh, you have to go get a mammo somewhere else another day. Maybe that woman took a day off of work. She came with her 3 children, took 2 buses. It's challenging. And so now we really obliterated that barrier to care, because that woman can come and see her provider that day and at the same time get her mammo done in the same place, in a place she's comfortable. So those are the things that FQHCs can do to really change the dynamics in healthcare.
That's amazing. So it's kind of like a one-stop shop.
That's correct.
And what other initiatives are you trying to add right now? Mammography is a fantastic example. Are there other initiatives that you're working on right now to bring in-house?
Yeah, so right now, one of the things that we're really trying to focus on is behavioral health, right? So there's such a lack of access for behavioral health services. So we're trying to increase that by adding more therapists and more psychiatrists to our portfolio of providers. We want to make certain that women, that everyone has a place to go if they're not feeling well, or need access to behavioral health services. And, with Jerome Golden Center, as everyone knows, in the county closing years ago, there's been a big vacuum in access to behavioral health services. So we want to make sure we start to increase that.
With 9 locations in Palm Beach County, but how many team members, how many employees do you have?
We have 265 employees currently.
Wow, does that include the physicians?
Yes, that includes everyone.
And I assume you have ARNPs, nurse practitioners, physician's assistants, medical assistants, all
the
all
whole
the crew.
thing. The whole thing, correct.
You can see I have a little too much exposure to the healthcare system.
You do.
So 265 employees. Wow, that's a large organization. And if it's public record, if I may ask, what is your annual budget?
Our annual budget now is close to $60 million.
60, 60.
60, yes.
Wow, that's fantastic. So you have 260 employees. I myself have quite a few employees. It's definitely a challenge getting everybody on mission and motivated. So tell us how you do that. I know you're a CEO like I am, so leadership comes with its own skill set.
Yeah, of course. I think that really you have to have a clear vision of what it is you want to do as an organization. Share that with all the employees, everyone, not just your team, but everyone in the organization. So I make sure that I continuously meet with all staff, directors, managers, not just the chiefs, right? We don't just sit, and make decisions and then kind of permeate down. We go and we meet with the staff and explain. We take feedback from the staff, and I consider myself a servant leader. So I'm on the front lines with the team. I make sure that they see me, that I'm visible, that they know that I'm part of the mission as well, and that if I have to work harder than they do, that I will. I'm prepared to do that.
That's fantastic. Sounds like you have a similar approach to I do as the servant leader, which is a great concept that's come up in the last, 10, 20 years, which really leads to success in organizations. So speaking of partnerships, you've got some really good partnerships. You recently got a $150,000 donation from the Gary and Vivian Player Foundation. Tell us about that.
So we, one of the things that when we started the Riviera Beach project, we really wanted to make sure that we reached out to the community and had them become part of this Riviera Beach initiative. There's so many folks that are kind and of goodwill, and Gary Player is one of those folks. He found out about this project, and he has a passion for pediatric care, so he went ahead and said, look, I want to be part of this. I see what you're doing in Riviera Beach. I see there's a need there. So he donated dollars to build the pediatric unit, and we named it in honor of his foundation. And we have still a lot of naming opportunities in the building because we want folks to be part of something greater than themselves. And if people want to do something where their dollar goes directly to helping the people of Riviera Beach or to really make a difference in healthcare, the Riviera Beach project really presents that opportunity for people.
I myself have 2 charities that I founded, and I found this organization called the Nonprofit Chamber of Commerce, which I was so surprised because they're not that well known. And it's like the regular Chamber of Commerce for businesses, but it's only for nonprofits, charities. So I wanted to ask, is FoundCare a member of that organization?
No, not yet, but I'd like to learn more.
Sure. Oh, so you didn't even know of it?
No.
Oh my gosh. So it's
nonprofits first.
No, it's a different one.
Different
it's actually
one. Okay.
it's the Chamber of Commerce, right?
Yes.
So it's actually there's a nonprofit Chamber of Commerce that is quasi-governmental, just like the Chamber of Commerce, I guess, is private. I don't even know. But it's got 400 charities in it, and it's all the CEOs of charities.
Oh, that's great.
So I got in because I have 2 charities, and anytime I meet someone who runs a charity, I ask them this question, which is, do they know of this nonprofit Chamber of Commerce? And I find it's like 50-50. They don't know, and it's such a great organization for resources because those of us who run charities all face similar problems, similar challenges, and we're not for-profit corporations. We're a nonprofit. So I'll get you that information
Absolutely.
after the show. It's really fantastic.
Appreciate it. Thank you.
Great organization. And in fact, they're having their annual dinner, or I think their annual function in a couple weeks, which I'm going to. So what do you think right now are the toughest challenges that FoundCare and your FQHC face currently?
I think we're facing a unprecedented time in terms of understanding where funding is going in the next couple of years. There are a lot of changes, a lot of things going on in government that are difficult to predict and understand. So I think those are the biggest challenges we currently face as an organization, right? And so we just have to continuously remain steadfast in how we spend money, make sure we pay attention to everything we're doing as an organization. But we have to continue to serve, and that's what we're going to continue to do. So we stay focused on our mission, and really just try to make sure that we stay ahead of the curve on any of the changes that may be coming.
I seem to recall from COVID that some certain cultures or some certain areas actually distrust the medical care system due to some injustices in the past. So do you face that in some of the certain ethnic communities that you're in? And if so, how do you handle that challenge?
Yeah, so that's one of the things that we want to make sure that we change. During COVID, we were one of the first organizations in the county to start testing in the parking lot. And we received national and up to even international coverage about what we did. And we just faced, just the same way we faced HIV in 1985 when we started as an organization, we faced COVID head on. And you have to make sure you face things head on. But really getting the trust of the community is key. So working with the community and going door to door to explain what FoundCare does is one of the things we intend to do in Riviera Beach. Is go door to door and explain to people this is important. It's crucial to your future and your healthcare. You know, I lost my dad when he was only 60 years of age. 8 years before he died, he had blood in his stool. And he never went to the doctor, was proud, was always pretty healthy. Long story short, he ended up dying from colon cancer spread to his liver, and he died at the age of 60. It was preventable. And that's why I'm so passionate about the work we do. And that's the story that we need to share with everyone in the community. Just going to the doctor one time a year can save your life.
That's great advice. Just once a year, folks. So, you know, those of you, I know especially men are a little too proud sometimes to go to the doctor. Maybe we're too scared of what might be found. But as someone who definitely, I go get my checkups all the time, and I'll tell you, you got to get over that fear, because they will catch something early, especially as we age. So does the aging population here in Palm Beach County also play into your mission?
Well, right now, about 8 to 9% of the folks we see are over 65 and over. As you know, there's a lot of options and places for folks to go. But one of the things we're finding is about 350 to 390 of our patients are aging to 65 and want to remain with FoundCare. So we're starting to develop more and more relationships with the insurers to keep our own clients who want to remain at FoundCare because of the multiple services that we provide.
Now, what is the interrelationship between your organization and then being able to accept Medicare when someone's over 65?
Oh, so that's one of the things that we're trying to grow in that space, right? So we already accept straight Medicare, but for those that have special Medicare, we're trying to get more and more of those contracts so that those folks can remain with FoundCare and not have to go and find another provider.
So for those of the listeners who don't know the difference between Medicare and Medicaid, why don't you explain that?
So Medicare is really strictly for folks that are over 65. Medicaid is really could be extended to anyone depending on eligibility. So it's not limited by age.
So Medicaid, I often say, is for people under a certain level of financial means.
That's correct.
And Medicare is just based on your age. So as soon as you hit 65, you're automatically on Medicare.
That's correct.
Wonderful. So I've been confused on that for many years, so that's why I wanted to share that with the listeners. So what's next? We have a couple minutes left. What's next on the horizon for FoundCare? What can we look forward to?
So FoundCare is going to continue to serve the community. We're going to continue to listen to the needs of the community to understand what it is we can do to serve. And we're going to continue to eliminate, and make sure that people are healthy. Our mission's pretty simple. We want to make sure that people are healthy, and we're going to continue to do that.
So for young folks who are looking to go into healthcare, particularly in the nonprofit sector, what advice would you have them? What should they take in college? What is the degree, and where should they go?
Nursing is a highly recommended. I hope all my kids become nurses. It's a great career that's not going to be replaced by AI. It seems, but you never know. But really, nursing is so important. There's such a need for nursing and medical. Become a doctor, become a physician, become a specialist. But really, always think of the community that you serve, and that there's a lot of need out there. So always keep in mind the others in need and try to serve in those areas.
That's great advice. So for those of us out here who heard your message, really want to help, whether it's by donation or by helping out just with our time, where do we go? Is there a website? How do we find FoundCare?
Sure. The best way is our website, to go to foundcare.org, FOUNDCARE.org. There's a lot of information there that you can follow, and we'd love to really get to know you. Anyone that wants a tour of one of our sites, would like to see our site, to see who it is we are, what we are about, before even you give a dime. I mean, I'd encourage you to come see what a wonderful organization FoundCare is, so that you can see the difference we're making.
Well, Chris, I am going to commit to that. I'd love to see your headquarters, and I'm actually particularly interested in your Riviera Beach location. A lot of my clients, as a car accident attorney and as an attorney, are actually in that same locale. So I would like to offer myself to come and see what help I could give your organization. It's just been a pleasure having you and learning about healthcare's mission and what FQHCs are. So, Chris, thank you so much for your time, and any closing words.
Well, Craig, I really want to thank you for the time. FQHCs do a remarkable job, and FoundCare is there to really help people remain healthy. And I can't thank you for your generosity and your invitation and having me here. It's people like you that really make a difference. So thank you for shedding some light on what it is we do.
Wonderful, wonderful. This is Craig Goldenfarb. I'm here with the Gold Standard Radio Show, and I've been here with Chris Irizarry of FoundCare and FQHC, providing wonderful services to those in need of health care.
That's a wrap on another episode of the Gold Standard Radio Show. A huge thank you to our guests for sharing their incredible journey and for being a true beacon of excellence in our community. At Goldlaw, we believe that when we lift others up, we all rise together. If you know someone in our community making a difference, someone who lives and breathes the gold standard, we want to hear about them. So please reach out, connect with us on social media, and let's continue celebrating the people who are shaping a brighter, stronger future for all of us in Palm Beach County. Until next time, I'm Craig Goldenfarb. So stay inspired, stay committed, and keep raising the gold standard.
Every day, 1,500 children in Palm Beach County wake up in foster care through no fault of their own. They have been torn from everything they know, facing fear, uncertainty, and unimaginable hardships. Many have suffered neglect, abandonment, or abuse, and now they must navigate a complex system that often falls short of meeting their needs. But they're not alone. That's where Speak Up for Kids steps in. We provide life-changing advocacy, life skills training, and essential resources to help these children heal, grow, and thrive. From educational support to everyday necessities, we bridge the gaps so they can have a future filled with possibilities. But we cannot do it alone. These children need champions, someone to stand in their corner, fight with them, and remind them they are valued and not forgotten. Will you be that champion? Visit www.speakupforkidspbc.org today and take action. Your support, whether through donating, volunteering, or simply sharing our mission, makes all the difference. Together, we can bring hope, stability, and a future to children who need it most. Don't wait. Take action now. Visit www.speakupforkidspbc.org and be the hero they deserve.